Alzheimer's disease is a brain disorder. It slowly destroys memory and thinking skills. This disease makes it hard to do everyday tasks. Imagine forgetting familiar faces or how to get home. That's the reality for millions living with Alzheimer's. This disease is the most common cause of dementia. Dementia is a general term for memory loss and other cognitive abilities. Alzheimer's accounts for 60 to 80% of dementia cases. It's a progressive illness, meaning it worsens over time. While there's no cure yet, understanding Alzheimer's is crucial. Early diagnosis and treatment can manage symptoms and improve quality of life. We'll explore the causes, symptoms, and available treatments to shed light on this complex disease. Scientists are still working to understand the exact causes of Alzheimer's. However, research points to a combination of factors. These factors include age, genetics, and lifestyle. One hallmark of the disease is the buildup of proteins in the brain. These proteins, called amyloid plaques and tau tangles, disrupt communication between brain cells. Think of it like this. Plaques and tangles are like roadblocks in the brain, making it hard for signals to get through. Another factor is the decline of acetylcholine, a chemical messenger in the brain. Acetylcholine is vital for learning and memory. As its levels drop, cognitive function is affected. While the exact causes remain elusive, ongoing research continues to provide valuable insights. This research helps us understand how to prevent and treat Alzheimer's more effectively. Alzheimer's disease affects individuals differently. However, there are common signs and symptoms to watch for. Early detection is key to managing the disease. Memory loss is one of the earliest and most common symptoms. People might forget recent events, conversations, or important dates. Difficulty with problem solving and familiar tasks is another red flag. For example, someone might struggle to follow a recipe or balance a checkbook. Changes in mood and personality are also common. Individuals might experience confusion, disorientation, or withdrawal from social activities. As the disease progresses, language skills, spatial reasoning, and judgment can deteriorate. If you notice these symptoms in yourself or a loved one, it's important to consult a doctor. Early diagnosis allows for timely intervention and support. Alzheimer's disease is a progressive neurodegenerative disorder. This means it causes the gradual loss of brain cells and function over time. As the disease advances, it affects various aspects of a person's life. One of the most significant impacts is on memory. Short-term memory is usually affected first, making it difficult to recall recent events. Long-term memory is also affected, leading to the loss of cherished memories and personal history. Beyond memory, Alzheimer's affects thinking, reasoning, and language skills. Individuals may have trouble finding the right words, understanding conversations, or following instructions. This cognitive decline can make it challenging to perform daily tasks and maintain independence. Furthermore, Alzheimer's can lead to behavioral and emotional changes. Individuals may experience agitation, anxiety, depression, or mood swings. These changes can be distressing for both the individual and their loved ones. Section 5. Who is at risk? Understanding the risk factors. While the exact causes of Alzheimer's remain unclear, certain factors increase the risk of developing the disease. Understanding these risk factors can empower individuals to make informed decisions about their health. Age is the most significant risk factor. The likelihood of developing Alzheimer's doubles every 5 years after age 65. Genetics also plays a role. Having a close relative with Alzheimer's increases your risk. Lifestyle factors can also contribute. Conditions like heart disease, stroke, high blood pressure, and diabetes can increase the risk. Maintaining a healthy lifestyle through regular exercise, a balanced diet, and social engagement may help reduce the risk. It's important to note that having these risk factors doesn't guarantee developing Alzheimer's. However, being aware of them allows individuals to take proactive steps towards prevention and early detection. Section 6. Navigating the journey, interventions, and management. While there is no cure for Alzheimer's, various strategies can help maintain quality of life. These include managing symptoms, supporting cognitive function, and ensuring a safe environment. Medications help manage symptoms but do not cure the disease. Non-drug approaches like cognitive stimulation and occupational therapy are also vital. Creating a supportive environment with clear routines and visual cues is crucial. Section 7. Bridging the gap: effective communication strategies. Communicating with someone with Alzheimer's requires patience, understanding, and empathy. As the disease progresses, communication can become increasingly challenging. However, there are strategies to bridge the communication gap and maintain a meaningful connection. Speak slowly and clearly, using short and simple sentences. Avoid using complex vocabulary or abstract concepts. It's helpful to maintain eye contact and use nonverbal cues like gestures and facial expressions. Be patient and allow ample time for the person to process information and respond. Avoid interrupting or correcting them, as this can lead to frustration and agitation. Instead, focus on understanding their message and validating their feelings. Remember to connect on an emotional level. Use a gentle touch, maintain a calm and reassuring tone of voice, and show affection and support. Even when words fail, a warm smile or a loving touch can convey comfort and understanding. Emerging research suggests that diet plays a significant role in managing Alzheimer's disease. While no specific diet can cure or prevent the disease, certain dietary patterns may help protect brain health and slow cognitive decline. The Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, and fish, has shown promise in reducing the risk of cognitive impairment. This dietary pattern is high in antioxidants, which protect brain cells from damage. Another beneficial approach is the MIND diet, a hybrid of the Mediterranean and DASH diets specifically designed to support brain health. The MIND diet emphasizes leafy green vegetables, berries, nuts, and fish while limiting saturated and trans fats. Staying hydrated is also crucial for brain function. Encourage individuals to drink plenty of water throughout the day. By adopting a brain-healthy diet, individuals with Alzheimer's can support their cognitive function and overall. Validation therapy is a communication technique for individuals with Alzheimer's disease. It focuses on validating their feelings and experiences, even if they seem illogical. Instead of correcting them, caregivers step into their reality and acknowledge their emotions. This approach reduces agitation and anxiety, fostering connection and well-being. While there's no cure for Alzheimer's, medications can help manage symptoms and improve quality of life. These medications work by targeting different aspects of the disease process. Cholinesterase inhibitors are a class of drugs that increase the levels of acetylcholine in the brain. Acetylcholine is a neurotransmitter involved in memory and learning. By boosting its levels, these medications can improve cognitive function and slow the progression of symptoms. Another class of drugs called memantine works by regulating glutamate, another neurotransmitter involved in memory and learning. Glutamate can become overactive in Alzheimer's, leading to brain cell damage. Memantine helps regulate glutamate levels, protecting brain cells from further damage. The choice of medication depends on the individual's specific symptoms and disease stage. It's important to consult with a doctor to determine the most appropriate treatment plan. Medications can provide valuable symptom relief, but it's crucial to combine them with other interventions like lifestyle modifications and supportive care. The fight against Alzheimer's disease continues, with ongoing research offering hope for a brighter future. Scientists worldwide are working tirelessly to develop new treatments and find a cure. Current research focuses on disease-modifying therapies and early detection. These efforts aim to slow or halt disease progression and identify at-risk individuals early. The dedication